Hi, good afternoon. This is your Rockland County Executive Ed Day, and I want to thank you for joining me today for our latest County Executives Update. It has been some time, so welcome back. We're here today to have an honest conversation about COVID-19. I want to acknowledge what is so clear to so many of you. There are major credibility and believability issues in messaging coming from Albany and from Washington, D.C. Constantly changing mandates, guidelines, data, science, and messaging has created tremendous confusion for everyone, including yours truly. You add some politicism, skepticism, and sensationalism, and you get the expected results. You have crisis when there's crisis. That does not work. We're now dealing with, on top of everything else, we're dealing with a state in political upheaval. We have a situation now where the State Department of Health has been non-responsive to us here locally. They have not spoken to the schools, and again, just to remind everybody, schools are a separately contained entity within Rockland County. They answer to the State Education Department, and they're seeking guidance for your children, and they've been having difficulty with that because the state has basically said you're on your own. That is the same kind of situation we're dealing with here in Rockland County government. Our local health department has been pretty much on their own, but the good news is that with our local health department, we're in great hands, so we will be fine. I'm here with you today not to talk about what others are doing, but to share with you what our local decision-making process is, so you can better understand and make whatever decisions you feel to be most appropriate for you, your families, your coworkers, and yes, your community. We will move forward together and take control of our own lives without the craziness we've gone through before, with the changing mandates, some of the ludicrous efforts that have been made to somehow magically knock down this virus. That is not going to be happening here in Rockland County under the leadership here of this administration. First, I want to share with you some of the local numbers we have here in Rockland, and we fine-tune these numbers and other numbers too to get a better sense of exactly what our experience here is in Rockland to share with you, which is important for you all to understand and know exactly what is going on in your county. 55% of Rockland's total population has received at least one vaccine dose. Now, many have seen that number and made a big deal of it. The fact of the matter is what has skewed that number is that we have areas in this county that have extremely high percentages of young people under the age of 12. That has made that 55% number, I think, artificially low. I'll offer this to you to make it a little more clear. 71.3% of Rockland's vaccine-eligible 18-plus population has received at least one vaccine dose, 71.3%. 67.9% of Rockland's vaccines-eligible 12-plus population has also received at least one vaccine dose. So, and when you keep in mind that the 12 and over cohort has only been eligible since May, these numbers are much stronger than we were led to believe before, because it is a true measure of who has been vaccinated among the eligible people who can get vaccinated. That was what was the comparison should have always been, and it really had not been from the state. As of Tuesday, this week we've had 612 active cases of COVID-19, and active cases are cases that are positive tests from the last 2 weeks that have been reported to our Rockland County Health Department by local test sites, medical practices, doctors' offices, and hospitals. Now that number is up from 322 cases last Tuesday, 205 active cases 3 weeks ago, and 151 active cases a month ago. Now, obviously, that is something we've been hearing as tremendous concern. Is it concerning? Yes. Is it cause for tremendous concern and anxiety? No, because we have seen this and this up and down issue here in the nation, as a matter of fact, when it comes to COVID-19. They call it a wave. We call it here a cycle, because the bottom line is that it's almost predictable exactly when we're going to see these spikes. But we have here, I'm going to see, John, let me know how I'm doing with this as far as our
Bring it a little closer. Good. There you go.
okay, you going to hold it?
Yep, I'll hold it.
Okay, all right, well, if you look over here, there's, the number here is 82, and this is a year ago in August. Then what we came into after that was the Jewish holidays, Rosh Hashanah, Yom Kippur, and you'll see the numbers go up. I guess we're over here now.
Yep.
To about 1649. That was. You can see the spike is very obvious on the chart, and then it dropped down again. Then came in the middle here is December and January. We had Christmas holidays, Hanukkah. The numbers spiked all the way to 2964, nearly 3,000 positive cases. Over here now we have Easter Passover, the next spike in the spring of 2021. So back in the spring of this year, we're at over 2,000 cases. Now we are at 612 on August 3rd. So if you look at this, you can almost see asymmetrically that we almost had an identical scenario develop in the year almost at the exact same times. I think we put that down there. Thank you, John. I forgot to say that, yes, John Lyon, my communications director, is here with me. He'll have a couple of things to offer during this broadcast. But you can see these often seem to occur around and after the holidays. Any time that folks get together inside and unmasked, apparently, there is a spread of this disease, and we saw it with the living room spread last fall and last winter. And this is one of the issues we spoke about. You remember with the restaurants, they were throwing people out of restaurants at 10 o'clock because in somebody's mind in Albany, they felt that at 10:01 this bug became a superbug, which is idiotic, frankly, but now we don't have to worry about that anymore. But what occurred there with this ridiculous misuse of data is they took people out of restaurants and threw them back in a house. Restaurants had, I think, was a 4% positive rate, and living room spread was over 70%. So they basically threw people right back into the area where most of the infections were occurring. And let's be perfectly honest with each other here. You are much more of a tendency to wear a mask on your own when you're outside at other places. When you're home with familiar people, you tend not to do that. And I think that really was contributory. Regardless of how you feel about masks, a mask is a physical barrier. I always marvel at the fact that through this whole discussion since last spring, a year ago last spring, it was like magic what masks could do. We had Dr. Fauci speaking about masks as, first of all, were not necessary. Then he was talking about them not there for your protection, they're for the protection of the other person. Now suddenly it's here for our protection. I marvel at the fact that these medical masks and the N95s have been around forever, and it would appear that everybody's just discovering now, the professionals of all people and the experts, what the masks actually do. In its simplest terms, any barrier in front of your face is going to protect you to some degree. Just like other things you spoke about with washing your hands, not touching your face, shaking hands, making sure you use a cleanser afterwards, whether you wash your hands or if you use one of the disinfectants for your hands. That's great. But to be very clear with you, we see 612 active cases now, when at one time not long ago, in fact earlier this year, we had over 3,000 cases. We do not know how severe those current active cases are. We just know they're positive tests. Many of them could be partially or completely asymptomatic. Now, if you're asymptomatic, you don't know you have it, you could actually infect someone else, obviously. We're also getting questions now as it relates to, can you carry the virus when you're immunized? That's another issue that we're looking at very closely right now, and we're looking to get a snapshot here in Rockland County about that, not what we're being told from the national level of government. What we do know, and this is thanks to the information coming from our local hospitals, Nyack and Good Samaritan Hospital. I'd like to thank Dr. Geller and Dr. Leahy for their efforts to work with us to deal with this virus. There are 17 people hospitalized and confirmed who have COVID-19 here in Rockland. 17. Now compare that to the 350 plus or so we had at one time here in Rockland. Not to minimize anybody who's in a hospital, but by the numbers, we don't want people to be over anxious when we don't have the numbers to support that. We don't wish hospitalization or fatality upon anyone, but the numbers are well within the hospital's abilities to handle. That's the important issue here, because one of the reasons we spoke of as to why we feel you should consider vaccination, because if that does work as well as it seems to be working, the impact of having the virus will be lessened, and you may not have to be hospitalized. You'll be hospitalized for a short period of time. hospitalizations are critical for a number of reasons, not because just someone who's sick directly, but also others who have to get treated in hospitals. Any compromising we do of the hospital system affects public health and public safety across the board. So it is an important dynamic to consider. We're working right now to increase both the amount and level of detailed information we are getting from the local hospitals so we can be better informed about what is happening in Rockland, and more importantly, share with you exactly what we hear here in Rockland County. That is very, very important, again, to address the critical need of believability that you have to have in order for us to work together to deal with this. That is my focus. My focus is not Albany. My focus is not Washington, D.C. My focus, pure and simple, is right here in Rockland County. There are many factors that have been closely monitoring all through the pandemic and will continue to watch as we guide our local response. As a reminder, this information and many other data points are publicly available by visiting rocklandgov.com, rocklandgov.com, and going to our dashboard hub page, which you can access from the main page on our county website, which is completely updated on Tuesday and Fridays each and every week. Within county government, let me speak a bit about what we're doing here, but John has something to offer here. John?
Sorry, before you move on here, on our dashboard hub page, we have so many different data points of information from hospitals, information from the tests we're getting back. There is so much information for you to look at that we are publicly disclosing and have had on our website since the very early days of this pandemic. We want to be transparent. We want to share this information with you, and we urge you to take a look at it yourself so that you believe us and trust in what we're saying.
Right. And again, with this information, this is just not something we're doing just because we feel like it. We're drilling down to get information that we believe will help guide us going forward and give us some better sense of exactly what we should and should not be doing as it relates to the virus and keeping the virus down. You who have watched me on Facebook Live before know I have been said many, many times, once we got that second wave, after the first one, I made it very clear, we have to learn how to live with this virus until we get vaccinations and we knock this virus down. We have vaccinations right now. We still have not knocked it down yet. We have to look at the efficacy of these vaccines, and the potential for boosters now has come up. Again, these are things that we will gain and get out to you. But at the end of the day, we have to learn how to live with this, and we're trying to provide guidance that makes sense based upon our actual experience and whatever information is being provided by the experts in the field. Within county government buildings, we require visitors and employees who are unvaccinated to wear masks, but our employees who are vaccinated and outside of the healthcare settings like the health department are able to go unmasked and not depending on their own personal assessment of risk. They can if they wish. Nobody's saying they cannot wear a mask. We're constantly monitoring and reevaluating this protocol. Now, this is something that local business must do, and frankly, most local businesses that I've seen have done. Our local businesses, whether they be retail establishments, whether they be restaurants, taverns, regular office settings, they've already established much of the best practices they can in order to protect folks who either come to their establishments or work in their establishments. So, I want to acknowledge those businesses because this is what I see when I go out. It's not unusual, but this is something that's being done, and I think it's working well here. So, but again, this is something all businesses have to do on a regular basis: reevaluate their situation. We're moving forward while ensuring that we have the correct personal protection equipment stockpiled for our employees and first responders, so that we can respond to everything that can happen next. So we already have put that in place. Those supplies are either here or more are coming, but it's something we've already been acting upon. Before we don't want to deal with any shortages. We want to make sure that we have plenty on hand. When it comes to our buildings and our staff, we have not considered any additional rules or mandates because the cases and numbers we are seeing, frankly, just do not call for it. This is a departure from what we've been sold before by other levels of government. There was like an automatic. Every time somebody sneezed, we had a new mandate. We're looking at data and experience here in Rockland County, so when we make judgments here, in addition to sharing these judgments with you and asking you for input, we also have an ability to explain why we're doing these things, and they're based upon actual occurrences, not something that's anecdotal. And when we're speaking of anecdotally, we are seeing things, other things too, that are very, very interesting. I have to do my grocery shopping like many of you do, and I shop in one of our local grocery stores here. And when the vaccines came out, I remember many people, even who were vaccinated, were still wearing the mask. And my sense of it at the time was, it's going to take some time for people to get comfortable to not wear a mask. They have been wearing them so long. There was a distinct anxiety in the air. We all knew this. And we figured eventually, once people got vaccinated, they would end up, getting rid of the mask. And maybe, I would say maybe 2-3 weeks ago, I was in a store, and I noticed that at that juncture, we went from the vast majority of people wearing masks, slowly but surely, we got to the vast majority of people not wearing masks. And then some of this the information came out about the Delta variant. I went into the store and walked in, and I felt like I walked into a different location. Most of the people in the store were wearing masks, just completely the opposite of what I'd seen simply a week or 10 days earlier. I actually was it took me by so much of an impact that when I left the store, I stopped and turned around to check the door to make sure that the store had not implemented a policy of people wearing masks regardless. And they had not. What they had done, just like it always had before, is once the vaccines came out, they put a sign up saying, if you're vaccinated, you do not have to wear a mask. What I find interesting, and the reason why I share this with you, is that people chose to do something that they were comfortable with. And it wasn't 1 or 2 people. It was a significant majority of people in the same setting that I saw made a judgment that for their reasons they felt it was important to wear a mask. There's nothing wrong with that. If this would comfort someone, if this would give somebody a higher sense of safety for their health, that's fine. But again, it just goes to show you that you have people here in Rockland County who know how to do the right thing. They know what they should do, reasonably speaking, to protect themselves, and will take those actions without being told. American citizens do not function well when their government, at the tip of a spear, tells them to do something. We saw this happen with the masking. It was a crazy situation developed here in this entire state and elsewhere. It doesn't work. It just does not work. The vast majority of people will do the smart thing and the right thing that's consistent with what the experiences are. It's for us here in government to provide those experiences, to let you know what is going on so you can make the decision. And I have every confidence that the vast majority of people will do exactly that. And this is why we have not enacted any additional mandates or rules. I do not see them as necessary with the local numbers that we are currently seeing. And also, we have significant doubt as to how well those telling people what they're going to have to do is going to work when we can have some success without it. That said, we are closely monitoring the situation, and I do urge our residents to take the common sense protective actions they think are necessary to protect their own health and that of their friends and their families. It's a very simple offering that I can give everyone here who's listening to this today. Personal responsibility and personal assessment of risk, not government mandates. That's for extreme circumstances. When you have 17 people in a hospital, that is not an extreme circumstance. That's why it's so concerning when we had people in other levels of government trying to tell people what to do with less stringent circumstances. People and businesses, as I said before, should review their existing plans and modify them as necessary depending on the specific circumstances. We all remember what happened when the governor turned around and said, no more serving dinner at 10 o'clock at night, because somehow in somebody's mind in Albany, they felt that COVID bug became a super bug at 10:01. It was asinine. And we had some significant discussions with the governor's staff at that time about how ridiculous that was. And again, the byproduct of that, people left restaurants early, obviously damaged business, but people went back to the living rooms, which is exactly where the spread was happening. So we're not going to function that way here in Rockland County. We're going to function in a manner that makes sense with the data that we have in hand. There is no one-size-fits-all approach. That is very important. We in county government recognize that what we can and what we cannot do. So businesses keep looking at your situation. People in Rockland, please look at your situation and make the best judgments on your plans and modify them accordingly. Modify your conduct accordingly. That's the only guidance I would offer to you at this point. But what we can do is inform you of the best data and information available, and that's exactly what we're going to do. Just as a general sense of it, we're generally going to be aligning ourselves with recommended course of action with guidance from the CDC, the Center for Disease Control, if, and it's a big if it fits for Rockland County. Again, my concern is not the entire state. My concern is that the United States of America in total. I mean, in this particular issue, obviously, I'm concerned about the USA. But right here, we're here to solve a situation in Rockland County. That's where we're going to go with this. We'll continue to provide access and availability of vaccines and encourage those who are interested in becoming vaccinated to attend an upcoming clinic. We have gone to every corner of this county to get vaccine availability to anyone who wants it. We've tried everything possible, and we will continue to find new ways of making that accessibility available to people. You can make an appointment online through our website at rocklandgov.com, or and again rocklandgov.com, or walk in during any of the dates and times that are listed that you see on the website. We have seen an increase in the number of people coming to be vaccinated during our recent COVID-19 clinics. People have been sitting back making judgments. I respect that, and we're seeing an uptick now in vaccinations, and we hopefully again, even if there's only a partial impact upon this virus, vaccinations would be a positive thing if your choice is to do so. We'll also continue to redistribute vaccines to local healthcare providers, pharmacies, hospitals, and nursing homes. We were one of the first localities to order additional refrigeration for vaccine storage. You remember my mentioning this before, because the state would not give us extra vaccines when we had the capability of maintaining the vaccines because of the additional refrigeration. We bought those refrigerators early. We bought them at very normal prices, unlike my colleagues in government who paid a lot of money a scam 2 months later for refrigerators. So we have that situation right there. We're ahead of the curve, and that has allowed us to store and then distribute more than 11,000 vaccine doses to more than 20 Rockland locations. In other words, we are fully prepared for whatever gets thrown at us, and that's the one thing I do want to share with all of you. I also want to reiterate that I myself am vaccinated. I do urge any of you considering to talk to your doctor about it. Don't just listen to whatever your neighbor's posting on social media. I know if it's on Facebook, it must be true, but it doesn't work that way. Of course, when I speak to you, it's true. But
there's a lot of irony in saying don't take everything on Facebook at face value as we're having this discussion
exactly.
on Facebook.
So this is I'm allowing for an exception to the rule right now. But I would say, look, please talk to medical professionals. If you're not comfortable speaking to your own doctor or you don't want to make an appointment, simply just call our health department. We'd be happy with medical professionals there. If you want to know the up-to-date information, whatever studies have been coming out, what information is coming out, how it affects different cohorts of people, is there something to be concerned about for you? Any medical issues you might have that you feel might compromise you or help you with the vaccination, you can speak to our professionals here, and then decide what's best for you and your family, and also, as I said before, your friends and your community. Questions. If you have questions, you can email COVID Call Center at co.rockland.ny.us, and John, that's going to be up on. Okay, John will have that in the comment section. Also, you can call our COVID hotline at 845-238-1956, 845-238-1956. That is a Monday through Friday, except holidays between 8 and 5 p.m. Mostly, I want to assure all of you that we in county government are closely monitoring the situation locally. We will continue to drill down and assess strategies that's based upon our Rockland-specific numbers, which are available for all of you to see as well. Complete, total transparency. We want you to have this information. We want you to be partners with us here. We will not talk at you. We will inform you. There's a big difference to what you've had to deal with before. We will provide the best available data and information with a focus on locally driven factors. We will share updated guidance for you to apply to your lives so you can make the best judgment possible. We will work hard to establish the credibility and believability you so deserve and was so lacking previously when this issue was being run by the state. With that in place, we'll be able to function as a team, and that is a critical, important piece to this. During times of crisis, we have to work together as a team. But once that team effort is secured, as I had said many, many times before, there is nothing that we cannot accomplish together as a team. We've faced down many crises here in Rockland County. We will probably have a few more going forward, but the one thing I've seen of Rocklanders is that when we work together as a team, we come out, we prevail. So again, I will leave it at that, and I'll just tell you, it's very, very hot outside. They sent an advisory out already for people to be very careful in this weather. But until next time we speak, and it will be routine, regular conversations we're having here, be safe, enjoy the very hot summer day out there in the next couple of days, and enjoy it as best as you can. With that, your County Executive Ed Day saying good night.